In this video, I will be talking about COVID-19 vaccination and its side effects. The COVID-19 vaccine will protect you from COVID infection and serious adverse effects of COVID-19 infection. But when you take the COVID-19 vaccine, there could be a possibility that there could be some side effects or some symptoms which come after taking COVID-19 vaccine. But majority of this COVID-19 vaccines side effects are very mild, 99% of them. Very rarely, less than 1% maybe, there could be serious adverse effect. But by and large, it's very safe with only mild side effects or mild symptoms after vaccination. Let me talk about common side effect first. The area where they inject in the muzzle, the vaccination, that place you can have some pain, local pain, and local redness will be there, and some swelling could be present. And other side effects of vaccine which affect the entire body is like fever, headache, vomiting like feeling, nausea, and sometimes chills and entire body ache. These are the common side effects. Majority of these common side effects can be treated with simple paracetamol tablet 650 milligram or 500 milligram, which is available over the counter. If you get fever, body ache, this tablet is sufficient. And it is not recommended that you should take this tablet before going for vaccination. It's not meant for prevention because not 100% of the people develop these common side effects. Very few. So whenever you get the symptom, then only you take this tablet, but otherwise no. And taking the tablet before taking the vaccine is not recommended. If you get fever, in addition, you can drink a lot of water, because fever there will be dehydration. If you drink a lot of water, it will be much more comfortable. And if you get fever, it is advised to wear loose clothings. When you take a second dose of the vaccine, the symptoms would be much more than the first dose. It indicates your immune response is better, but symptoms could be worse than the first dosage. You should be aware of that. When you should approach doctor or hospital after vaccination? If you develop the local tenderness at the site of injection, if it doesn't comes down but rather it keeps on increasing, if the redness of the injected site keep increasing, you should come back to doctor or go to hospital. Likewise, also if you develop any severe allergic reaction, you should approach the doctor soon after you develop. One thing is that many people go out without maintaining the physical distance and other COVID precautions soon after taking the vaccination. That is not correct, because COVID vaccine takes time to build up the immunity, and it is after second vaccination, second dose of the vaccination, then after 14 days, then only reasonable immunity will be developed. Till then, you need to maintain the physical distance and other COVID-19 precautions. Let us talk about the serious adverse reactions which can occur after COVID-19 vaccinations. So I will enumerate one by one. First will be anaphylaxis. What is anaphylaxis? It is a serious and severe allergic reaction which can come at around 15 to 20 minutes or 15 to 30 minutes after vaccination. But luckily it is very rare. So maybe 3 to 5 in 10 lakh people. That is the occurrence incidence. So that's the reason we say after taking vaccination, you should be around the medical facility for 30 minutes. Then only you should move around, so that we can pick up any anaphylactic reaction if it occurs. Another serious adverse effect what has been observed is thrombocytopenia with thrombosis, or we call it as thrombosis with thrombocytopenia syndrome. Here what happens is blood will start clotting in some of the patients or the people who take vaccination. Along with there will be decreased platelet count. So it's a very rare side effect, occurs in couple of vaccines, not all of the vaccines. Sometime after taking vaccination, people will have some problem like myocarditis and pericarditis. It is a inflammation of the heart or burning type of episode in the heart which occurs. But all the health regulatory bodies are seriously monitoring this side effect. But so far, what we have found is it is very, very, very rare. No need to worry about that side effect. But it is there in very, very few people. Another question regarding serious side effect is being asked is death due to vaccination. Once again, whatever the data has been compiled in USA, it did not show any direct correlation with the vaccination and the death. Although death may have been occurred after taking vaccination, but it could be natural deaths. But very recently, the blood clot related death after vaccination has been reported. But once again, the incidence is very, very low or negligible. Some people ask, what is the long-term side effect of the COVID-19 vaccination? The answer is, it is negligible, and till now we don't have any data, but whatever the data we have is very, very less, and you can say there's no long-term side effect of the COVID-19 vaccination. If you or any one of you develop any side effect after taking COVID-19 vaccination, you can mail to us at the displayed email ID, or you can comment in the below comment sections. Thank you.